So hello everyone and welcome to the webinar, Cannabis Moving Forward, Protecting Health, hosted by NABCA. Over the past few years, many state and local governments have loosened restrictions on medical and in some cases legalized adult use of cannabis without much input from public health. As a result, policymakers have been left to create regulatory systems with little input from the public health sector. To help fill this gap, the authors of the book, which is also the title of this webinar, Cannabis, Moving Forward, Protecting Health, took evidence-based research and drew upon their years of public health experience to pen a framework for cannabis regulation. It is modeled after the book Toward Liquor Control, a publication that served as a blueprint for alcohol regulatory approaches following the repeal of prohibition. As a trade association representing alcohol regulators, some of whom also regulate cannabis, the National Alcohol Beverage Control Association, or NABCA, is hosting this webinar to bring awareness about this book and its findings. Also, the Cannabis Regulators Association, or CANRA, a nonprofit organization, can be a valuable resource as it provides unbiased information about cannabis legalization. Before I introduce the presenters, I wanted to address a few housekeeping notes. Let me first introduce myself. I am Maggie Barshini in the Communications Department at NABCA. Also with me are Cassandra Torre and Kadar Dange, who are in the Policy Department at NABCA. This webinar will be about an hour. If you have questions, please email communications@nabca.org and one of us will ask it on your behalf. Please include your name and your organization in the email you send us. You can find each of the presenters' slides under the Handouts tab in the GoToWebinar platform. The webinar is being recorded and will be available on the NABCA website within 7 to 10 business days. It will be under the Policy and Research section of the website. So our presenters today are Catherine Patterson, MPP, Co-Executive Director, City Health Initiative. We have David Jernigan, PhD, Professor at Boston University and Assistant Dean of the Practice. And Linda Fraser, Director of Addiction Initiatives at Advocates for Human Potential and past chair of the Alcohol, Tobacco, and Other Drugs section of the American Public Health Association. So Catherine, in a moment, I am going to give keyboard and mouse control to you, and hopefully everyone will be able to see the presentation on the screen.
Thank
I'm
you.
going to turn my camera off. Hold on.
No worries, Maggie. Maggie, thank you so much. I'm going to attempt to move the slides forward. Bear with me if they are lagging a little bit. Thank you so much for being here today. I'm really excited to share a little bit more with you about who De Beaumont is and why we were interested in weighing in on the issue of legalization of non-medical cannabis. So first, a little bit about the foundation. The De Beaumont Foundation is truly focused on public health writ large. And the way that we think about ensuring conditions for health for all is really focusing on policy, partnerships, and the public health workforce. And what a doozy the last 2.5 years have been for the public health workforce. We're a national mid-sized foundation. We make grants every year, but this particular work was really a partnership, and I'm going to talk a little bit more about what that looked like in just a moment. So many of you have probably seen this tome. Another philanthropist in the 1930s had this commissioned. John D. Rockefeller Jr. Was really looking at that vacuum that prohibition had left in the policy space around alcohol, and commissioned this report to truly look at how best to regulate alcohol at the state level. I think it's really interesting to note that we are in a similar period right now, where we have multiple states who have gone ahead and legalized non-medical cannabis and medical cannabis, but you also still have it prohibited at the federal level. But things are still proceeding, right? This is still moving. We still have states that are putting this on the ballot that might go ahead and regulate this in the future. What is the best next step for states? I also would be remiss if I didn't just mention the experience and the expertise that NABCA brings to the table here. As Maggie mentioned previously in her opening remarks, NABCA has already been in this space, tracking, analyzing, keeping tabs on what is happening at this level. And my friend and colleague, Dr. David Jernigan, actually brought the foundation together with leadership at NABCA and said there has to be something for the field here where we are able to really talk about the priorities of public health, put that first and foremost, but also make some evidence-based recommendations for regulators. And that resulted in a book that we put out in 2021 that I'll talk about a little bit more in just a second. I just want to highlight the goals that de Beaumont had for this particular publication. When we think about the world in which you all live, it's really interesting to note that prior to 2021, there was a lot of different guidance out in this space, but there was no unified public health take on legalization of non-medical cannabis. I think it's also really important to note that the foundation itself does not take a position on legalization. For us, it was really a question of when, not if, and given those conditions, what can we offer back to the field in terms of evidence-based and evidence-informed recommendations. So we also wanted to say, what is the state of the evidence? What do we know? What do we not know? We know we don't know a lot. We also wanted to look at what happened in states that had already legalized cannabis. What had they learned? What could we learn from them? And then finally, what is happening in other countries that we can also glean and take from? So it was really important for us as both a foundation and a partnership with Dr. Jernigan and other authors to really highlight what are those North Star goals that we all have when trying to fill this policy vacuum. First and foremost, thinking again from that public health perspective, are we protecting youth? Can we make sure that we're prioritizing that? Are we looking at the prevalence, the frequency, and the intensity of cannabis use across the United States? How can we help make sure that we're reducing harm, both to individuals and to communities? In an era of misinformation and disinformation, how can we make sure that we're pulling together everything we know and making sure that we're packaging that in a way that is both accessible and usable for policymakers? And then finally, and probably most importantly, what are we doing to counteract the influence of industry? Because we know the motivating factor for industry is to make profit. What can we offer back into this space with that public health perspective in mind that can bring some balance to what is already out in this particular arena? So over the period of 2 years, a long 2 years, we put together, I'm really proud to say, a very comprehensive book that was put out in 2021. It was published by APHA Press. Maggie already noted the title, but I'll just state it again. It's called Cannabis Moving Forward and Protecting Health. This was the state of the evidence as it stood when we were writing the book, really trying to document and make sure that there was a credible source of information out there on harms and benefits of cannabis use. Again, the book doesn't take a position on legalization, just trying to offer the evidence and recommendations back to policymakers and making sure that we had credible information in terms of the state of the field of evidence. I think it's also interesting to reflect the role of philanthropy here. I started this conversation with mentioning John D. Rockefeller. What is it about philanthropy and the role that they occupy in our society in terms of both the obligation and the opportunity we have as a sector to weigh in these topics? What I think is very interesting is that as a foundation employee, I am only beholden to our board of directors. That's a pretty rare and privileged space to be. So what are we obligated to do? When I think about my board and I think about my CEO, Brian Castrucci, he believes strongly, they believe strongly that we need to really use the power that we occupy in society and use our voice. How are we influencing the public narrative? Is there something to be said that we have license to that other groups may not? We really felt like this was an opportunity to work with groups like NABCA and Dr. Jernigan and make a contribution in this space. And then I think finally, I would be skipping some of the tools or some of the strategies that de Beaumont employs if I didn't mention the role of policy. So this book is really focused towards policymakers. What is the regulatory guidance or checklist or structures or evidence that we can offer to folks who are already grappling with this issue? And how can we make sure those tools are designed to protect health? That's how de Beaumont has always thought about policy and using policy as a lever. And that's what we've tried to do with this book as well. So at this point, I'm going to pass it over to my friend and colleague, Dr. Jernigan. David, I'm going to go ahead and mute myself and take myself off camera, and I turn it over to you. Thank you so much, David.
All right, Catherine, I'm going to step in and I'm going to give keyboard and mouse control. Well, let me take you away from keyboard and mouse. And David, I am giving you keyboard and mouse, and give me a moment to mute myself before you show.
Okay, thank you very much. And thanks right off the bat, both to NABCA for sponsoring this webinar and to the de Beaumont Foundation for supporting this work. This being a NABCA webinar, I wanted to start just first by being transparent. My background is primarily in alcohol policy, but to say a little bit about alcohol and cannabis. The big question is, are these substitutes for each other or are they complements? Are people using one instead of the other, or are they using both at the same time? And I've got to say, the most recent reviews looked at 95 studies and concluded there's no agreement. Part of this is because it depends. It depends on the pattern and context of co-use. Depends on the timing and order of use. Depends on what cannabinoid formulations and pharmacokinetic interactions are at play. And it depends on user characteristics. We're finding different things in different populations. I hate it when researchers say this, but the bottom line is it's complicated. However, what is clear is there's an enormous overlap occurring in the industries. Between tobacco, alcohol, and cannabis, Altria has invested $1.8 billion in one of the biggest Canadian producers, Constellation, $4 billion in another big Canadian producers, Molson Coors in yet another Canadian producer. All this is happening in Canada at this point because the product is still federally illegal in the US, but you can bet that the moment that it becomes legal at the federal level, these companies will wade in. At the same time, there's another relationship between alcohol and cannabis I need to mention, which is that when we come to cannabis policy, it's apparent that we've failed to learn the lessons of either alcohol or tobacco policy. So this is the book. You've seen it, you've heard about it. In a shameless act of self-promotion, you can order it directly from APHA Press. What I'm going to talk about is what we found. What we found is that states need to consider the overall regulatory system. They need to consider the 4 Ps, which we've talked about forever in alcohol policy. They need to consider social justice issues, enforcement issues, and surveillance system issues. And I'm going to talk about all 8 of these in the next few minutes. First, regarding cannabis regulatory systems, we identified 6 possible systems and laid out the strengths and weaknesses of each. Home cultivation, permitting simply home cultivation, is an option. The advantages are there are no retail stores allowed, there's very little industry influence. The disadvantage is it's very difficult to put any kind of restrictions or controls on the product. Cannabis social collectives. This is one of the options that Uruguay is using quite successfully in terms of public health, where individuals can cultivate up to a maximum number of plants and share or either give or sell at cost to other club members. Again, there's no retail. There's a little bit more state control possible over the product. There's very little minimum industry influence, but there's still going to be some issues about product quality, use of pesticides, and so on. Government monopolies. This is NABCA's bread and butter. And this was an option for cannabis. None of the US states have pursued it so far, to my knowledge. But as in alcohol, there would be a single government agency responsible. There are a lot of strengths: control price, control physical availability, put restrictions and controls over the product, and put in place prohibition and marketing controls. The weaknesses: if the retail level is not part of the monopoly, then private retailers may do a whole lot of marketing on their own that can promote excessive consumption and expand the market. Public authority is very similar to government monopolies. There are some legal opinions that because this is federally illegal, then state employees cannot handle such a business, as would be the state with a government monopoly. A public authority is a way of states having an arm's length relationship while maintaining a lot of the control that they would through a monopoly system. Then there's licensing, and there's licensing that is public health focused, where there's a competitive private market, but it's heavily regulated and public health and safety goals are clearly set, and where regulation occurs preferably through the State Department of Health. Again, can keep in place pricing controls, control physical availability, put restrictions on products, and can also take a number of steps to limit the influence of the industry, including prohibiting vertical integration, regarding licensing of every tier of the industry, limiting the number of licenses permitted to each owner, requiring licensees to be perhaps nonprofit organizations or collectives to reduce the profit motive, and prohibiting industry members from lobbying or serving on advisory boards. The weakness, of course, is that this is still a public licensing system, and public health agencies may not be as experienced in business licensing and regulation and fall prey to industry capture, as has happened so much of the time with alcohol. And then there's what we have. And this is a licensed regulatory system oriented to the commercial market. It's normally overseen by some kind of cannabis dedicated control agency. There are no particular strengths to this from a public health perspective. It is what's preferred by private businesses and venture capital because it allows them the maximum freedom to develop profit-making enterprises, and it has a whole range of weaknesses. Most particularly, it is very vulnerable to industry influence. So our summary at the system level, it's important to be aware illegal markets won't disappear overnight. There's a lot to learn from alcohol, tobacco, and it's much easier to start conservatively and liberalize than to start liberally and get more restrictive, as some of the states are already discovering. And again, monopolies, public authorities, and public health-oriented licensed regulatory systems will provide greater control over distribution, sales, and promotion of the product. The general advice here, we should be moving slowly. We should be keeping the businesses small, both to prevent undue industry influence and to maximize local control. And we should adopt a licensing system, if we go in that direction, that is public health focused, that guards against regulatory capture, prohibits vertical integration, prevents industry influence over policy decisions, keeps the businesses small and diverse, and permits local jurisdictions to put additional requirements on cannabis businesses. Local control is so important, as we've learned in alcohol, and it's important that jurisdictions be able to opt in rather than having to opt out of having cannabis distribution facilities within their borders. And local control can also come into play in terms of time, place, and manner restriction, things like days and hours of sale, signage, distance from sensitive land uses such as schools, recovery homes, and so on, and product delivery. The issue here is the profit problem, and this is a quote from Bo Kilmer, who works at RAND and who has been working on cannabis issues far longer than I have. To be profitable, most firms will need to maintain and encourage heavy use, which could have serious implications for rates of cannabis use disorder and other public health outcomes. It's important to realize that a very small sliver of the cannabis using population consumes the vast majority of the cannabis, just like is the case for alcohol. Products are a nightmare. These are just a few of the things that are available, both takeoffs on existing products and also product innovation, like cannabis-infused beverages. So in the product space, there are some specific policies we recommend. We recommend prohibiting concentrates, establishing a THC ceiling, banning the use of all but an approved list of pesticides, and California has done well here. If allowing edibles and drinkables, prohibiting sale of them within 1,500 feet of schools, and prohibiting any product deemed to be appealing to children. And then packaging. There should be child-proof or child-resistant packaging. The packaging should have rotating and specific health and warning labels that cover at least 30% and preferably 50% or more of a package's principal display area. Again, we've learned a tremendous amount from tobacco about warnings and what's effective. We're not following any of it here. We should require plain packaging, that is no branding, and require clearly visible labels that list the percent concentration and the THC to CBD ratio. None of this consumer information is routinely available at this point. And we should also require labeling that indicates that whether pesticides were used in cultivating the product. This is really a consumer right to know issue. Physical availability, very similar to alcohol. The more available cannabis is, the more likely people are to consume it, and the more likely there will be public health and safety problems ensuing from its consumption. So policy options here, again, every state that has legalized non-medical adult use to this point has made it 21-year-old minimum purchase age law, but there should also be no one under 21 employed in cannabis businesses. There should be population-based caps on the number of cannabis outlets and at least 1,000-foot buffer zone from sensitive land uses. We should ensure that zoning restrictions and proximity buffers equitably distribute cannabis businesses throughout a community, and I'll come back to this shortly. And we should include cannabis provisions in social host laws, which the alcohol policy folks are familiar with, and enforcement is critical, and I'll talk about that more in a couple of minutes. Regarding marketing, it is truly the Wild West out there in some states. And what we recommend, and a lot of this is in spaces that regulators are not accustomed to looking at. This is a quote from a publication that we put out. We've done some of the only work monitoring youth exposure to cannabis marketing. We wrote, while the alcohol and tobacco industries crafted their original marketing campaigns decades ago using traditional media, cannabis businesses have their origins in the digital age, and consequently, they rely largely on social media to sell their products. All right, so what do we know? A majority of cannabis-related social media accounts are actually run by advocacy groups and industry interests, rather than by individuals sharing opinions or experiences, even though this is what they look like. Furthermore, a number of Instagram influencers appear to be doing paid work for cannabis companies despite a ban on cannabis businesses advertising directly on Instagram, Twitter, or Facebook. And what we did was one of the first studies of youth exposure, and we found that adolescents who saw billboards rarely or sometimes had 5 times the odds of a cannabis use disorder. while those who saw billboards most or all the time had 7 times the odds of weekly use and 6 times the odds of a cannabis use disorder. Billboards are the one form of advertising where you can't turn the page or turn the channel. So they are inevitably exposing vulnerable populations. And then branded merchandise. Adolescents who own this were 23 times more likely to be weekly users. At the policy level, one of the simplest things that states could do is simply remove the tax deductibility of marketing expenses for cannabis. This would greatly increase the actual cost of marketing to cannabis businesses, and it would not involve any issues around freedom of commercial speech. Really, really simple step. Nobody's doing it. The restrictions should be focused on marketing content and placement should look at what is allowed rather than what it is prohibited, because then there's some control over industry innovation. As we've discovered and argued for in alcohol, advertising should be restricted to events and media where audiences contain 15% or fewer youth under 21, which is roughly the percentage of 12 to 20-year-olds in the general population. There should be a state cannabis scientific advisory board to review the scientific literature in order to approve or reject any health claims or ads that could be appealing to youth. And we should be using counter advertising, which was so effective in tobacco. On prices and taxes, the taxes should be set high enough to increase prices post-legalization, more than countering the drop in price likely to occur in the wake of legalization. Taxes should be based on potency to discourage excessive consumption and should automatically adjust for inflation. Again, all of this is simply lessons, primarily from alcohol. Minimum pricing, minimum markup, and tax floor policies should be put in place, and price promotions and bulk purchasing and so on prohibited. And the taxes should generate enough revenue to adequately support a robust cannabis control agency that can evaluate the health and safety impact of legalization, as well as state and local and mass reach interventions, substance use prevention, cessation and treatment, counter-marketing, surveillance, and evaluation. On the social justice front, this has been a great motivator for reform of the cannabis laws. It's a great idea. However, it's naive to think that simply by reforming the cannabis laws, we're going to get rid of discrimination in law enforcement. What we're finding is that both before and after legalization, cannabis law enforcement disproportionately is affecting poor and particularly African-American communities, with long-term effects on both. Legalization has been driven by concerns about these disproportionate effects. Decriminalizing arrests could address this injustice without the full legalization of non-medical cannabis for commercial sale. And research suggests that legaling cannabis for non-medical use decreases the overall number of cannabis-related arrests, but does not eliminate the racial inequalities among those arrested. So, regarding social justice, we should decriminalize. We should establish expungement programs for previous cannabis-related criminal convictions, and the onus on the government should be on the government to do this expungement and not on previously convicted individuals, which is what's in the federal bill being considered and promoted by our vice president. We should address the disparities in arrests of African American and Latino persons in and of themselves, separate from changes in cannabis policy, and explore options for investing cannabis revenue into socially disadvantaged communities without linking those initiatives to cannabis businesses, which is what many states are doing. They're incentivizing people in the communities most affected by the war on drugs to become involved in the cannabis business. This is simply going to lead to greater concentration of cannabis businesses in those communities. And what we found is that, we found in alcohol, that the alcohol outlets are over-concentrated in poor and minority communities. We don't need more of that. Monitoring, surveillance, this is the bread and butter of public health, and we are so not ready. The existing national surveys still ask the wrong questions. They're not up to date on the current products, strength, etc. There's no detailed national legal database, trafficking policies and changes over time. State licensing, enforcement, and adjudication data are often not accessible, and we need publicly available seed-to-sale tracking systems for cannabis production and sales that are consistent across states. And then finally, we need more research so we can understand and regulate cannabis impairment and traffic crashes. Enforcement, there needs to be sufficient resource and expertise for enforcing cannabis laws, and the policies and practices cannot be influenced by revenue or by needs or cannabis industry pressure. There need to be clear enforcement guidelines and protocols and publicly available and accessible records management systems that track enforcement actions and include data by income, race, and sex to facilitate public monitoring of equity. This is what legalization is looking like across the country. The big question, can the tortoise win this race? And for the final word on that, I'm going to turn this over to Linda Frazier from the American Public Health Association. Thank you.
Thank you so much, David and Catherine, for setting the stage.
Hold on, Linda. Let me give you presenter capabilities. So I have just made you presenter.
So very happy to be here and share my experience. Want to just say that I've been working with APHA and the Alcohol, Tobacco, and Other Drugs section on cannabis since 2012. We wrote the first cannabis regulatory policy for APHA in 2013. And that has since been updated. I'll talk a little bit about that today. I come at this from a clinical perspective. I'm a nurse by training and experience. I've done work in prevention, intervention, treatment in a variety of clinical and public health settings over the last 30 years, and have spent the last 15 years doing consulting in implementation science. How do we really bend the needle on 17 years from research to practice in healthcare and medicine? And I'm finding that that's a challenge even in drug policy. I don't have any financial or other relationships to disclose. So I want to go back to the American Journal of Public Health and a publication they did in 2011 that really jump-started a lot of discussion about health equity in drug policy and started moving us in a direction of thinking at the American Public Health Association and in the section about what it meant to approach the work we did with this lens forefront. And the reason I like to focus on this is that in the midst of trying to figure out what the research and our past experience shows us, we need to stay grounded in some of the realities of the historical landscape over time. And a lot of drug policy in the United States that started or was codified with the Controlled Substances Act in 70-71 is really grounded in some of the historical context of the Nixon administration. And I feel like I'd be remiss if I didn't point that out and we didn't keep that at the forefront. It's a pleasure and a privilege to continue to work in the leadership of APHA with the de Beaumont Foundation and other organizations that are focused on public health policy and practice, particularly as we've been facing the challenges of the last few years with the COVID overlay. But it was in 1994 that the 10 essential public health services were identified and articulated. And that was updated to put equity at the center in 2020. And this really affected what the section was doing in trying to consider updating policy statements and the work that we were doing with communities and local public health authorities and public health entities around the issue of drug policy across molecules. So the section really approaches this from a broader perspective than one substance, but how do we take the context and landscape into consideration when we're considering specifics of tobacco or alcohol or cannabis or opioids or other drugs. So I won't spend a lot of time on this, but for those of you that work in the regulatory space, as I have, I worked in the state of Maine for 10 years and oversaw, was the single state authority and oversaw programs for mental health and substance abuse treatment across the state. And trying to keep in mind how you approach regulation and policy and what you do at the state and local level from the perspective of public health really boils down to these three buckets of how do you assess and monitor, how do you move systems and infrastructures that aren't developed or changed quickly towards developing policy that's research-based and gives you the impact or the outcomes you're looking for. And what are we doing in the realm of assurance? And again, a reminder that as we think about assurance, it's more than just enforcement. Doesn't mean that enforcement is not important, but that we need to be doing more than just looking at enforcement. We need to be looking at infrastructure at all levels and how we monitor and hold accountable and be transparent about how systems work. With that, and putting equity at the center of the framework. So we'll share the slides, but wanted to talk a little bit about what that means specific to the cannabis space. As we've rolled out legalization at the state level, while we have not done anything to change what's at the federal level significantly, we've really started to run into some challenges, particularly in the health equity arena, which is not unheard of or unknown when it comes to drug policy. So what you'll notice is there's a lot of overlap in what the work that the DeMont Foundation has done and what's in the book that really supports what the section and APHA have been raising as concerns in policy and trying to highlight research that is in terms of what we know and what we don't know. But what we see, boots on the ground with legalization, is that decriminalization, although it can be used as a regulatory mechanism, doesn't always lead to equity in terms of expungement of criminal records. And David addressed that very well in his presentation, that we need to recognize that there can be separate things at play, that decriminalization, medical legalization, and adult use legalization are all separate and distinct and require paying attention to all of those regulatory mechanisms, including marketing and oversight. A lot of what we see marketed is really based on medical markets that are not well regulated. This bifurcation between the state and federal regulations really puts vulnerable populations at higher risk. When you have federal funding that becomes jeopardized if people sign up or begin to use medical markets. Public housing, supported living, veterans benefits, these have all been really sticky issues with the current status. And stigma continues to be an issue in the drug policy space, including cannabis. These are sort of the top list of what we see bubbling to the surface in playing out at the state and local level. I'm not going to spend a lot of time on this. And I like to share this visualization. AHP got federal funding from NIDA and SAMHSA to host the first public health research conference on cannabis legalization in 2017. And John Kelly was our keynote speaker and reintroduced me to this visualization of what we're up against when we talk about learning the lessons from tobacco and alcohol, thinking about how it applies to cannabis, and putting equity and public health and safety at the center of our approach. And what you see here is basically what a lot of words in books and research have shown, which is the sweet spot is that we really have to pay attention to what are the best research supported approaches to regulating markets. And the book and David's presentation really highlighted the pros and cons of different approaches and how we have to weigh those things out and think about how we create a dynamic, robust infrastructure so that we can fine-tune what we're doing in this space for the good of population health and public safety. So I would be remiss if I didn't mention a bit about the APHA policy. I have to say how APHA policy is developed is that it's sort of like developing legislative initiatives that have to be voted on. Everything that turns into or is approved as a policy by APHA has to be grounded in research. And one of the challenges with writing the cannabis policy was there are areas that we have lots of research in and other areas that we don't yet have the research to support or drive how we should manage regulation and what the impact of different approaches to market regulation may have on some of the key measures. And as David very astutely outlined in his presentation, we're not necessarily measuring, we don't necessarily have the right mechanisms in place in our surveys and the research we're doing to actually get a fine view of what the impact has been of drug policy, and particularly cannabis policy. So what we found when we wrote the 2020 policy for APHA was that action items really boiled down to 4 bucket areas: protecting children, youth, and vulnerable populations, minimizing harm to the public, prioritizing equity and social justice to ameliorate harms, and making sure that we are monitoring patterns of use and outcomes. I'm not going to go through each of these 4 areas in detail. I can assure you that they align very well with what is in David's and Catherine's presentations and the priorities that are outlined in moving forward protecting health on cannabis regulation. But what may be helpful to folks is knowing that the APHA policy actually articulates specific regulatory actions that you can be looking for at the state or local level, and ways and language for advocating for what you need to do given the landscape in your local state, whether it's approaching discussions about legalization or legalization has happened and you want to be engaging with your local regulatory authority. So these 4 buckets are outlined in my slides. And lastly, wanted to just note that what we found from both of our research conferences and the research we did for the policy is summarized and aligns well with what David and Catherine have already presented. I think one of the things I wanted to highlight is when you get a copy of the slides, there are links to resources. There is a public health learning collaborative that the ATOD section and counter tools have started. So if people are interested in that collaborative, or if you are a regulator and have a public health liaison or person on your team that you'd like to get involved, Elizabeth Gerndt would be the person to connect with. And the last thing I'll say before I end here is I'm happy to hear from people, but over the years with the 2 cannabis summits and the writing of the APHA policy. We've worked very closely with Jillian Schauer and others who are doing, like David and others, doing research in the public health and cannabis regulatory space in the work we've been doing, and would encourage people to help us create a collaboration of key stakeholders to really begin to address these issues and have some influence. We could do a whole nother webinar about what's happening at the state and how industry is influencing through lawsuits to prevent some of the more effective approaches to regulating cannabis at the state level. And I think those are issues that need to be addressed as we see consideration of legalization at the federal level moving forward. Thank you.
Okay, Linda, thank you very much. I want to remind everybody that if you would like to send in questions, please do so at communications@nabca.org. And we have Cassie and Kadar standing by to ask questions. So Cassie, I will turn everything over to you now.
All right, thanks, Maggie. So a couple questions have been rolling in, and as you mentioned, send them to communications@nabca.org and we'll get them answered. So one of the first questions that came up is for Dr. Jernigan. You mentioned several times how there were many similarities between alcohol and cannabis policy best practices. Was there any difference in potential regulations between the two industries that stood out?
Cassie, I'm sorry, your audio went out at the beginning of the question.
Oh, let me repeat it. Said that you mentioned several times that there were many. Can you hear me now?
You're going in and out.
Okay, I'm
okay,
sorry.
Similarities.
Yes, similarities between alcohol and cannabis policy best practices. Was there any difference in potential regulations between the two industries that stood out?
They're very different drugs. They need to be approached differently, but we really didn't focus on what the big differences were. We focused rather on how many similarities there were and how little the lessons of alcohol and tobacco were being followed when we go to regulate cannabis. Really, it sometimes looks like people are saying, oh, cannabis, now we're going to make adult use, non-recreational, non-medical use legal, and this is a whole new field and we have to create it out of whole cloth. No, we don't have to create it out of whole cloth. There's a tremendous amount of knowledge and information there already.
Thank you, David. This looks like it's for anyone on the panel. We have found in our state, the state is New Hampshire, that the industry has touted social justice as a reason to commercialize, but when we propose social justice policies, many of the ones suggested in the webinar today, they are quick to denounce them. How can we bring the industry on board when it comes to social justice policies?
I can take a crack at that one. I'm not sure anybody has the perfect answer to a very important and timely question. It is absolutely true that many of the things that were identified as best practice are things that the industry has brought lawsuits to prevent. And the trick with state legalization is that states will not go to court to fight those battles because they're expensive. And so we've seen this happen in Illinois, in Maine, in Massachusetts, where regulatory entities have tried very hard to protect small business or take a craft approach to be in line with what experience would say would be a better approach. And then the industry takes issue, files a lawsuit, and the state eventually backs away. So I don't have the magic answer. This is going to take time. It's going to take attention. I think Massachusetts has made some headway after long and hard work by the commission there. It's not perfect. We will see what happens. But I think it's also a good opportunity. The question gives me the opportunity to say, I think one of the things we need to do is quit circling the wagons inward and shooting at each other. We need to circle the wagons out. We need to recognize the difference between trying to move people from illicit markets to licit markets and the challenges of moving through that process, and the difference between people in communities and how we approach social equity and protect communities that are vulnerable, and at the same time recognize who the big industry players are with the big money. And we're not doing a very good job of sifting through that, paying attention, and we still, and I include public health professionals and clinicians in this, we are all more prone to point fingers than we are to join together like we know we should in public health, convene key stakeholder meetings, be clear about when and where it's appropriate for industry to have a say in regulatory approaches and when it's not. And as somebody who oversaw methadone clinics, methadone regulations, rewrote single state agency contracts, right? We know how to do this. And to David's point, Dr. Jernigan's point, we need to be better at educating one another and making sure that education is coming from the public health space and when we're joining together in those efforts, rather than allowing the industry to pull levers behind the scenes and pit us against each other, quite frankly.
I would just add to that, the question is a little off base to my mind in that the job of the industry is to make money. It's our job as public health, as communities, et cetera, to keep the social justice issues at the forefront. I think Linda's points are really important about engaging communities, encouraging community voices, and encouraging the voices of people who have been most affected by poor policies in the past in these conversations, and putting real limits on or understanding when it's appropriate to have industry input and when it isn't. We've learned a lot about this again from alcohol and from tobacco, and those lessons should be applied.
Thanks, David. Another person has asked if there are any upcoming learning institutes for people who are interested in digging deeper into cannabis policy work. They have really enjoyed this topic and it's been covered very quickly. It's a very dense topic area and they would love to have more opportunity to look, let's see, it says, look at them more closely and see what actionable steps localities can take on them.
There are no, go ahead, Linda.
Well, same answer. You know, I was fortunate to be able to lead two conferences. I no longer have the funding and ability to do that, so I agree we need to do that, and I think that might be a really great first collaborative thing to do. The CANRA, the regulators are very interested in continuing to hear more from public health, and until there's more movement, and I like the de Beaumont Foundation, don't take a stance. I don't advocate for legalization, but I think Dr. Jernigan's last slide is perfect. We need to figure out how to win the race between the tortoise and the hare. And we need people to step up and partner and collaborate, and we probably need to figure out how to come together and fund learning institutes that support people at the local and state and federal level and how we approach these issues. I think there's a willingness and an interest, but we haven't we haven't been able to join arms quite yet in a manner that gets that coordinated.
Yeah, I would just add, the book has been a really good platform for starting to do some of that work. I've spoken in multiple states about the book, speaking to various groups of policymakers about the book. It's just been a great platform. So thanks again to the foundation for that. There is a need for a deeper dive and for educating ourselves. There are many misconceptions in our own field about what makes sense to do going forward here. And frankly, we need all the help we can get to get the evidence base out there.
Thanks, David. So maybe this is a good question for Catherine. Are you having conversations at the national level in order to include public health focus if national legalization occurs?
Fantastic question. The answer in its simplest form is yes. De Beaumont is more engaged at the state and local level. Federal policy, while it can be incredibly impactful, is a long, slow game. We have always focused our efforts at the municipal or the state level. But I'll also say I'll give a plug to Linda and also to APHA. APHA is an incredible partner in terms of informing the field, getting conversations started. Linda knows this far better than I, but there's a lot of differences of opinion even within that one group. That's a critical community that can come together and hash out, what are you seeing in your communities? What is working? What kind of questions are you getting if you're getting questions from regulators either within your city or your state or at the federal level? And APHA does that in federal policy. So I think it's also to the point of, yes, should we leverage our power at the federal level? Absolutely, but we should also leverage our partnerships and make sure that we're activating those as well.
I would also encourage people to take a really close look at some of the legislation that's being proposed in Congress, because there are assumptions being made in progressive circles that things are much more progressive than they actually are. And I'm talking specifically about the MORE Act, which just has some big problems in it and is going to make things perhaps tougher for some of the communities most heavily affected by poor policy that passed, rather than improving things. This is a lively federal conversation, and public health needs to be at that table.
Thank you, David. I think that's a good note to end on and turn it back over to Maggie to give a few final words before we close it out.
Thank you very much, Cassie, Kadar. And thank you so much, Catherine, David, and Linda, for your time and for sharing your valuable knowledge with us. We thank every one of you for joining NABCA for this presentation. Also, please visit nabca.org, the website, for various resources, including white papers, previously recorded webinars, and other materials. It is our goal to give you the information and the tools you need to perform your functions effectively. So please be on the lookout for a NABCA survey that will be sent to you soon. We'd be grateful to have your feedback. And so thank you all again for being here. This presentation is concluded, and we wish everyone an awesome day. Bye.
Thank you for having us.
You're welcome. Thank you.
Thanks.